bit, you two go. Is that better? Yeah.
Thank you, Gavin.
And you're live. You're welcome.
All right. Good morning, everybody, and Happy New Year to you all. This morning we're introducing our motion in relation to what are known as Section 39 organisations and the need for pay restoration for those who work within those organisations. Section 39 organisations are companies within the healthcare sector. They include major charities who provide services in disability, in healthcare, include some of our hospices around the country, for whom were given budget cuts in 2010 and again in 2013 as part of the FEMPI process at the time, but who have not been given restoration, similar to those workers within the HSE. We've been trying to raise the issue for some time, both I as public expenditure spokesman, Biddy as health spokesperson. The unions involved have been trying to negotiate with government for some time. The Department of Health say it's not a matter for them. The Department of Public Expenditure say it's a matter for the HSE. However, we now have a situation where we may be faced with an industrial dispute in March unless there is a pathway to a resolution. And immediately prior to the Christmas recess, we passed laws here beginning the pay restoration process for people working for the HSE. However, that does not apply. So you have a situation in some areas around the country where nurses within the HSE have got pay restoration. Nurses who work for organisations, for instance, such as rehab, have not got that pay restoration because the HSE haven't given the money. The government cannot tell us how many Section 39 organisations there actually are. And that is proving it more difficult to get a cost of a resolution to this situation. And what we're proposing is that this would go to the Public Service Pay Commission for negotiation and for a pathway to recovery, that the Public Service Pay Commission will actually adjudicate how many organisations are affected, and we'll be able then to give an idea of the cost of this. But in one major national organisation, I'm not at liberty to give their name, it will cost €1 million. In another smaller but significant national organisation, it will cost somewhere in the region of €300,000. We're talking about large sums of money, but nothing excessive. And in the context of the services provided by these organisations in disability, in healthcare, including some of our hospices, the cost of not being able to provide the service will be far greater. I'm going to ask Biddy to speak on this from a healthcare point of view.
Yeah, well, what's critically important when you look at this is the fact that services are provided by Section 39s across the country in a wide array of areas, in the areas of health and disability, home care settings, and many other areas. And it's key to the delivery of healthcare and other social services. So from that perspective, we do need to ensure that there is parity of pay between Section 38s and Section 39s and the broader health services, primarily to recruit and retain staff. Some of the Section 39s are having huge difficulty in trying to retain and recruit staff and to provide services. And the idea that a Section 39 company can, out of its block grant from the HSE, fund increase pay and at the same time it not affect services simply will not work anymore. They've been cut to the bone over the last number of years, and it is creating huge difficulties and challenges, as I said, in terms of delivery of services. But on a personal level, what it does, it undermines families that have loved ones, children that depend on these services, and very often they're finding it very, very difficult now, in the sense that the services are being pared back, are being cut and undermined. And the other key issue as well that is causing huge difficulties is the compliance with HICWA and the obligations for these organisations to be compliant. That all comes from the block grant. So the idea that you have compliance, that's essential, and no additional funding being provided for that means that these particular Section 39s simply are incapable of providing the services. And bearing in mind, the state doesn't provide these services in a meaningful way, and that's why the Section 39s are there.